more on the pulse this afternoon because Chief Executive Officer of the University of Ghana Medical Center, Dr. Darius Osei, is urging regulators of the health sector to harmonize their operations as a means of ensuring health service providers acquire the appropriate licenses for practice. Currently, service providers have to submit themselves to various regulators for licensing. This, Dr. Osei says, sometimes becomes cumbersome for the providers who end up circumventing the process. Speaking at a conference of health CEOs in Accra, Dr. Osei said when these bottlenecks are removed, the health sector will be sanitized.
The authorities can look into their documentations, and where there are duplications, they can simplify them so that people are easily regulated, because we are talking about the professional licensing. We are talking about the amenities that you need to work with. All of them must conform to certain standards. Now, if you have to register as a practitioner, first of all, you must go to the health regulation, but that's a HIFRA. And most people after HIFRA will want to have the NHIA, who is the authority, because that has become the health financing for most practice. And you can see that most of them are demanding the same documentation. My question is, how do we work together and make most of these processes simplified and easier, so that it's not like practitioners are difficult and don't want to be regulated, but we must also facilitate it so that it becomes easier for us to go through the normal processes. We are saying all these things because at the end of the day, we want to see quality care.
So how can this request be granted? Joining us on the phone is Head of Health CEO Practitioners, Kwame Jikuno. Good afternoon to you. Many thanks for your time, sir.
Thank you very much for having me on your network.
So you say you have identified this problem as a reason why many owners of health facilities do not get required registration. So what have you done about it aside the conference you held, knowing the health of the patients is paramount?
Okay, first of all, let me say good afternoon to your listeners, and also good afternoon to our members of Health CEOs and Scientists Network across the country, and then our patrons and executives. This 8th African Health CEOs and Practitioners Conference come in handy because, first of all, as our team, harmonization of regulatory framework guidelines is very important because as facility owners, so let me first of all explain what Health CEO is all about. Health CEOs and Scientists Network is an association of health facility managers and institutions across the country. It means that anybody that owns, mostly private ones, owns a facility within the health sector is part of us. Now, the reason why we are having this conference is geared towards the regulatory bodies that a facility owner, whether herbal, whether medical, or whether pharmacy, there are a lot of challenges that the person faces. So, for example, when you want to work or when you want to open a facility like a clinic or hospital, there are various regulatory bodies that you need to deal with. The first one is the HEFRA, that's Health Facility Regulatory Agency. That needs to certify your place or your premises to find out certain requirements that is needed to make that facility accessible and be able to get all these things that are needed to enhance healthcare delivery. So your facility needs to be certified by HEFRA. Now, the medical doctor who works there needs to be certified by Medical and Dental Council. I don't know whether you're getting me.
Yes, I'm with you.
Okay, so the medical doctor needs to be certified by Medical and Dental Council. Next, or the nurses there also by Next and Midwifery Council. The lab person also needs to be certified by Allied Health. So when you look at the chain of people that you need clearance to set up a health facility, it's very cumbersome. Now, in case you have any challenge in getting all these requirements, it means that you can't function as a facility. So that becomes very difficult. When it comes to the herbal, one, you need to get certification from TMP, so that is Traditional Medicine Practice Council, and then also other requirements that you need, which is a little lower than when you have to come to with products, which is food or drugs that you have, that means that you need Food and Drugs Authority. There are various requirements that are required. So the whole health system here, so as practitioners, we want stop measures or measures which will enhance healthcare delivery, but the various steps in getting all these things become too cumbersome because we want to put that facility all here and there. That difficulties we think that when we put the various regulatory bodies under one umbrella, it will help. So it becomes one-stop shop to get whatever requirements that you need to operate or to work as a health worker or as a facility owner. So that's what this whole conference is here towards. But beyond that, we also want to bring members together. We believe that even within among ourselves, we can also regulate ourselves. Those that may be, at the lower level can learn from those that are at the higher level.
So, Mr. Jikuno, how strong is your monitoring mechanisms?
You say how strong is our monitoring mechanism?
Yes, please.
You mean for membership?
Yes.
It's very strong because anybody that is a member of Health CEO, first of all, needs to get all the requirements from all the regulatory bodies. So if you're a clinic to become a member, we need to make sure that you are in good standing with HEFRA, and then so it means that you are a facility which can become member of Health CEO. Now, within ourselves, we have continuous training for ourselves, not only in Ghana. Even this year, we took members outside Ghana to look at the best practices. Now, these best practices is not only good for the facility, it's only good for we, the practitioners, we, the hospital owners. So we send practitioners outside Ghana. We also have continuous training for the various components within the health. So we have the doctors, we have the nurses, we have the allied health, we have those conferences. So this one, very one we are doing is geared towards the CEOs themselves. We have another one which is for only nurses. We have another one which is for doctors, and so on and so forth. So we believe that this training gives much understanding and the new trends that are in the health sector for anybody that is coming in to be able to, work effectively. Whilst we seek for the regulatory bodies to look at the gray areas and then the areas that even they themselves are not looking at, because there are new areas of healthcare which we are even talking about the technology area of health, like e-health and here and there. Okay? Currently, there are issues regarding all of that. So we believe that when we begin to look at our laws, because there are some facilities, you'll be there and then you have maybe some people from HEFRA coming to regulate you that you're under us. And the same facility will be there and then GMPC comes down, you're under us. So where are you? Do you get it? So
yes,
conflict here and there. We believe that when we come together, first of all, HEFRA will come to do presentation. HEFRA has already come to do presentation. So those questions are asked. Then CMPC will also come to do presentation. Those questions are where those gray areas are, then we seek for amendment. If there are various institutions which has those laws which are supposed to be amended, we work towards those ones. So we believe that this kind of conference is helping.
Well, I'm extremely grateful for your time. Dr. Kwame Jikuno is head of health CEOs, and he's been speaking on how they're monitoring their members to ensure that they go through the right processes to acquire licenses, and also look at how their facilities will be standard. Now, Christian Council of Ghana casts doubt on calls for a legislation to regulate activities of pastors that are taking advantage of their members. That's a conversation we're going to be having after this.